Provincial government will not hold public hearings on legislation that would allow hospital patients to be transferred to a nursing home without their consent. We are joined live right now by Maureen McDermott, a long-term care advocate. Thank you so much for joining us on CB24 Live at noon. Obviously, this is causing a lot of emotions, a lot of controversy in the province. Talk to me about your immediate concerns about this legislation.
Yeah. Well, the immediate concern, number one, is the role of the caregiver is certainly going to be at risk here. We know that putting your loved one into long-term care in the first place is one of the most difficult things that you're ever going to do. So if they're in a hospital right now and you now have to work with that fear that perhaps they could be 100 kilometers away, even for me, say my mom was put into Mississauga. Let's say I work full time. Let's say I don't have paid time off at work. Let's say I have children to raise and a family, and now I have to deal with the fact that perhaps my loved one is hundreds of kilometers away. What if I don't have a vehicle? What if I don't have access to transportation? You're basically taking that loved one, you're taking the care away from the caregiver, and somebody is stepping in and making that choice for you. You know, it's not sort of surprising how disgusting it is unbelievable, especially with the caregivers and advocates. But when you tell this province, when you're creating this legislation, that you're basically saying that long-term care is about a third of your concern for seniors in Ontario, by giving long-term care to a minister that already has 2 other postings, what is that saying about long-term care in Ontario and where this government's concern is? It's absolutely appalling, and we will not sit quietly about this. And many of us had put our names in ready for the public inquiry into Bill number 7, and now we've been silenced on that as well.
And there's been a chorus of these concerns that have been waved towards the long-term care minister. I'm just curious, what's your response to his responses to a lot of these concerns that seem to be, echoing right across the board from so many deeply concerned loved ones?
It's something that caregivers have sort of gotten used to the last 2 years during this pandemic in long-term care, because we've certainly been knocking on doors. We've been knocking on Paul Calander's doors. We've been writing letters. We've been to his office. We've had bullhorns and loudspeakers, and we've tried everything. And he refuses to talk to any of us, to acknowledge any of us. And if you're talking about a long-term care resident, you need to attach a caregiver to that, because generally every one of them has a loved one that's dealing with this along with the residents. So the caregivers have been ignored. The closest we've come in this government in the last 2 years was Rod Phillips had a meeting with us, Dr. Vivian, and other caregivers, and there was no media involved. It was a very genuine conversation. That's one conversation in over 2 years. And now we're being told that they will not even accept our opinions in a dignified manner, in the proper way of legislation, in this, what we thought was a democratic society, but that's no longer happening.
There's been no shortage of backlash to this legislation. We also know the long-term care minister said that, part of the reason why they wanted to do that is to free up some of these hospital beds. But, the logistics that you were talking about, the concerns about having a loved one, shipped off to a home 100 kilometers away is clearly not sitting well with people here in the province. Maureen McDermott, we're going to have, I'm sure, a lot more conversations about this bill. Thank you for your time.
Thank you very much.